Welcome. I'd like to welcome each of you here to Staying the Course, a community forum on addiction and the opioid crisis. My name is Jennifer DeWitt, and it is my privilege and pleasure on behalf of the Housatonic Valley Coalition Against Substance Abuse and our host, the City of Waterbury, to welcome each of you here today. We are delighted to have you here to participate and share in this event, so thank you very much for coming. There are a lot of really great things going on in and around the city at this time, this afternoon, so I think that the crowd that we have here is a really good testament to the importance of this collaborative work that we're doing together, and united we are stronger. HVCASA is one of 5 regional behavioral health action organizations across our state. We serve 43 towns of Western Connecticut, and together we are funded by the Department of Mental Health and Addiction Services to support local level substance abuse prevention and mental health promotion efforts. HVCASA is committed to promoting best practices in prevention and behavioral health across the lifespan. From late 2004, when I started working in prevention, to about 2014, HVCASA and my former agency, the CNV RAC, we typically held forums on awareness-raising topics such as underage drinking, distracted driving, current drug trends, K2, spice, things like that. And we were really just beginning to scratch the surface of the opioid epidemic and seeing the earliest results of the opioid medication overprescribing practices and the earliest stages of the resulting impact that those practices were having on our communities. And then in 2014 and beyond, the topic and the title of these kinds of forums changed to making a call to action. And the focus was really on educating the public and each other about what was happening and identifying how to mobilize and respond to the immediate risks and the crises that we were seeing related to opioid use and its consequences at all levels of the community. And so now today, we are here together again and engaged in a multi-strategy, multi-agency, multi-pronged effort, and we're all learning and managing as collaborative systems to stay the course, if you will, as we continue to navigate this problem. And so that's why on your agenda you have a compass today, because we're all figuring out how to navigate and what our direction is. So this is our theme. Our theme for this afternoon is staying the course. As agencies, as community sectors, and as partners, what kind of vehicle are we riding along in? What does that vehicle look like? Is it a sports car? Is it a little clunky vehicle? Is it a bus? Who's steering that vehicle? What kind of paddle or fuel are we using to propel ourselves forward? And what is our destination, as well as the course that we must travel to get there? So I want us to recognize that this work is not just about opioids anymore. And in fact, it really never has been. Today it's all about all illicit substances. It's about substance use disorders, and it's about co-occurring conditions and the risk and protective factors that affect them. So I want us to keep that in mind as we consider how we are staying the course. And I have to say that I'm so very excited to hear from our panelists today about that, and they'll be introduced to you in a little bit. At the time, when we had our last forum 3 years ago, it was a very different theme, and I reviewed our wonderful video that we had of that event, and there were just a few things that were so different compared to where we're at now. So for one, we were just really starting to roll out Narcan education and distribution at the community level. We had no recovery coach programs in any of our emergency departments across the state. We had barely heard of Vivitrol as a medication used to assist in the treatment of opioid use disorders. Most of our providers were not even offering medication-assisted services at the time. It was a very specialized service 3 years ago. We were less aware of the power of our language 3 years ago than we are today. We now say the term person with a substance use disorder instead of addict. We now say person in recovery or recovering person instead of clean. A lot has changed, but we still have a very long way to go. A wonderful colleague and a mentor of mine who could not be with us this afternoon said to me once, creating change for us is like turning around a cruise ship. And I laughed and thought, that's such a perfect analogy. It is laborious and tedious work. It seems like it takes forever, and it requires a lot of patience. And while we are engaged in this slow and laborious work, we lose people along the way, and that takes a toll. Human life is lost, and others are affected. And this is the importance of the work that we do today. So whether you are traveling along on an ocean liner, a cruise ship, a rowboat, a canoe, or a submarine, I hope that we are all traveling along together and in the same direction and toward the same goal, which is healthier, happier, and safer communities. So I'd like you to keep that in mind as we continue on our afternoon's forum. I would like to tell you what's in your packet if you didn't get one on the way in. You have an agenda, you have treatment resources, you have information about Narcan training and about our opioid work group meetings. You have information about marijuana and vaping and other illicit substance use. You have some information about harm reduction strategies, such as syringe exchange services and the effectiveness of them through the Centers for Disease Control. You have a lot of different kinds of resources, and I hope you take the time to look at them. And you have on the back of your agenda a list of just a few of the very many supporters and sponsors that we have for this afternoon's event. And I'd like to thank American Medical Response, which is the organization that houses my office and that actually put together all these packets. I have to say they have a brand new copier, and I put it through the paces in the last few days with all the papers you've got in there. So we're really grateful to them and their support of us. And as always, we're really grateful to the City of Waterbury. I've had the privilege of having the city be the hub of my service area since I started in this field, and with our expansion, I still have so many supporters and people who've said, stay here, stay in our community, and that really means a lot to me in the work that we do. So I thank you for all of you who have supported us through this transition over the past few years. And I'd like to also acknowledge our partners in the room that work in primary prevention. So we have some prevention coalitions here. We have a member from ASAP, Advocates for Substance Abuse Prevention, which is Woodbury and Bethlehem. We have some folks that represent SMART, with this Southbury and Middlebury, acting responsibly together. We have folks who represent SUN, the Step Up Noggy Coalition. And in each one of our communities, we have a local primary prevention coalition that's doing this work along with our intervention partners and our treatment partners and our recovery partners. So find out who yours is and how you can connect to them. With that said, I would like to introduce you to our great mayor of the City of Waterbury. If you're not from this community or you don't know who he is, Mayor Neil O'Leary needs no introduction whatsoever. What I will say about him, his biography is in your packet, is he's an absolute champion when it comes to this issue and this topic. He knows the business, and he knows all of the factors contributing to the crisis that we see. So he has a few words that he'd like to say to you, and we are expecting Senator Joan Hartley's aide to join us as well for a few words from Senator Hartley, who is in session right now. But for the moment, I'll turn the microphone over to Mayor Neil O'Leary. Thank you.
Thanks, Jen. I'm not quite sure Senator Hartley's going to be able to make it.
She's not working.
Good. Okay, great. Yeah, she called in a panic early this morning, and I guess they were up all night debating the minimum wage bill, and literally all night. Literally, I went to bed at 11 o'clock, and they were debating it on the floor, and I woke up at 6, and they were still debating it on the floor. Anyways, thank you all for being here. I see mostly familiar faces. First of all, I want to start off by thanking Jennifer for the great work that she's done in keeping everyone focused and together on this issue. We're honored to have our commissioner with us here today. We were so happy in January of this year when the incoming new governor, Lamont, did something that's kind of unusual, kept the same commissioner in charge of the Department of Mental Health and Addiction, and she's here with us today. And it was a relief to all of us because she's been so involved on this issue and so knowledgeable. And one of the biggest fears when you're a mayor or a town leader, when you get a new administration, normally they change everyone. And then you got to start all over again in some cases, or it's just hard to get people familiar with where you dropped off and where you start up again. And in this case, in this so important case of our opioid challenges, I thought it was amazing that Governor Lamont kept the commissioner in place, Commissioner Delphin Rittman, and you know, it's an honor to work with her because she's so accessible and gets it and understands the issues that we're all challenged with. Thank you for all of our providers that are here. Thank you to our friends from our Public Defender's Office who are here. there's a couple of great things to talk about, but before we get to those, I just want to remind everybody where we are, because I know that there are some trends in Connecticut and other parts of the country that have seen the opioid death rates stabilize or even drop off in some places. Well, that's not the case in Waterbury, unfortunately, and we need to remind everybody in the room that that's not the case, and hopefully our message will get out through the media sources that, we're still struggling here in Waterbury. And, I'll just quickly run through the numbers, all the way back in 2014, we had 18 deaths, 15, 32, 16, 33, 17, 49, 18, 56. 2019, at this time last year, we had 15. Well, today, as I stand before you today, we've already had 24 deaths. And it's really sad. It's amazing to me because I've been reading what you all have been reading, and I was expecting a stable or a downward trend, and unfortunately, it's not that way. 2016, we had 197 Narcan deployments. 2017, 183. 2018, 263. And without those Narcan deployments, the numbers are staggering now. I don't even want to think about what would happen. It's just awful. And, we've come a long way though, right? When we all sat together in this room and over the different occasions over the years, very few people were willing to, in the beginning, even accept that there was an opioid problem. And then there were very few prescribers that were willing to accept and understand the issues, correct? And then even though Big Pharma settled a $700 million lawsuit in 2007, here we are in 2019, and just about every community and every state in the country has now brought more action against at least 7 of the largest opioid manufacturers in the world, of which, the largest one is right here in Stamford, Connecticut. So it's been a struggle. It's been really a struggle to get our message out. But through your efforts and the great work that's been done, the awareness campaign has been the most successful, right? So folks and people really understand, what it is, in fact, and how it is to live with an opioid addiction. And I'm so grateful to Governor Malloy, and Governor Lamont is carrying the same flag and recognizing and understand that this is an illness. We are trying desperately as law enforcement, my old hat, my new hat too a little bit, to recognize and understand that people need help, not jail. People need alternatives, not prison. People, recognize and understand, thanks to the work that everyone is doing in this room, that there are alternative treatments that are successful. Problem is, there's not enough. And of course, there's never enough money. But since we were together the last time, we have opened up an alternative treatment center here in Waterbury on the west side of town that is doing really good work and a lot of mentoring and therapy. And we have other providers in the city that are doing great work. But the issue, unfortunately, the instances in Waterbury still continue to climb. And the alarming, when I talk about this outside of this city, what a lot of people just still don't understand is, out of all those deaths we've had in 18 and all those Narcan deployments in 18, more than half of those are not people from Waterbury. Those are people that come into Waterbury because they're so desperate, they cannot and do not have access to prescription painkillers any longer. The federal government, of course, has stepped up their efforts to really monitor and hold the prescribers accountable. The state legislature has passed laws to limit the number of opioid prescription and painkillers, obviously, that can be prescribed. All that has consequences because there's still a number of people out there who are so addicted and no longer have access to the painkillers through prescriptions, so now their illness doesn't go away. And as we all know, so now they're forced to come to an urban environment where heroin is available. So went on the police department in 1980 and spent a lot of years in narcotic enforcement. And, I was just amazed through those years at the heroin trade. And, it was always one of our biggest issues, right? Remember, it was heroin, it was crack, it was regular cocaine, and of course, marijuana related. Well, what's happening in 2019 and 18 and 17 is nothing at all like we were accustomed to in those decades back with the heroin trade. So the heroin demand shot through the ceiling, and obviously the price went up with the demand. And here in a city like Waterbury on a rail line, it's not unusual to see people coming in from New York where they can sell a bag of heroin in New York for $5 and sell a bag of heroin in Waterbury for $10 or even $20, depending on how desperate the customer is. And of course, heroin is not what it used to be either, right? Now it's fentanyl. And now, the fentanyl, where does that come from? China, Mexico. It's so incredibly dangerous, and that's what's happening. People are ingesting what they think is regular, what they're used to, street-level heroin, and then, of course, you all know what happens when it's fentanyl-laced and it's not mixed to the way that they're accustomed to. And you all know that people try desperately to get better, and they try to get into programs, and they try to stop their addiction, and they do whatever they can to try. So then they stay off the drug for a while, and then they slip back. And when they slip back, they ingest the same amount that their body was used to before, and that's where the trouble is. So there's so many different things. I'm preaching to the choir. I know I am. This is covered by television, and we continually try to get our message out through our local access TV channels so that our parents, right, our parents, our grandparents, our siblings will understand the magnitude of the problem. And I think that's what I commend all of you the most for. The awareness campaign found its way to Washington, D.C. The awareness campaign found its way to Hartford. The awareness campaign has found itself to all local leadership. We still continue to have to make sure the awareness campaign finds its way into every household, because there are still so many parents who suspect there might be a problem. They don't know how to deal with the problem. They're nervous about the problem. There's still a stigma attached to the problem, although I think the stigma has been much reduced because of the crisis that we're in. I think people finally recognize this as an illness, and I think people finally understand, because I don't know of a family, including mine, I don't know of a family that hasn't dealt with this issue. I don't know. I really don't know. And if they say they don't know, they may not be telling you the truth. Because the reality is, it's touched every family in one way, shape, or form, and it certainly has touched every community, every school district, and beyond. So we continue to work closely with all of you. City of Waterbury is very grateful to have a very aggressive health department. We have our fire and police officials. Adam Renko from the fire department here is our emergency coordinator. His leadership on this has been amazing, and we have, even though our numbers don't reflect, I almost get anxiety thinking about what they would be if we weren't as aggressive, working with all of you to try to continue to work so diligently to save lives. So I am thrilled to have you all here. We have a great panel here. I'm really interested to hear from them. And I'll turn it back over to Jennifer. And really, again, I want to just thank Commissioner Delphine-Rittman for coming here and continuing to make this at the forefront of her office, because you need that kind of support, right? We need that kind of resources that the state of Connecticut has to make sure that the funding continues to come our way, and to make sure that the support and the awareness campaign continues to come our way. And hopefully sometime soon, hopefully in the immediate, we'll level off and see the decline. But until that happens, even if it does decline, we're still going to always be faced with this. Isn't just going to go away. This is not going to go away. So we have to continue to be diligent no matter what our numbers look like, because, as you know, one life lost is one life lost too many that shouldn't be lost. So let's work together, continue to work together, and thank you all.
Thank you so much. Thank you, Mayor O'Leary. Before I introduce our commissioner, I was remiss to acknowledge my partners at the Housatonic Valley Coalition. Our executive director, Ms. Allison Fulton, is here today. Just wave. As well as Kathy Hanley, our wonderful prevention coordinator. And the wonderful woman at the door in purple who welcomed you and asked you to sign in is Jennifer Dillon, and she is our AmeriCorps Prevention Corps service member serving in our office right now. And unfortunately, AmeriCorps was supposed to be here today, was not able to make it due to a car breakdown. But we have AmeriCorps and Prevention Corps and VISTA service members serving in a variety of capacities here in and around Waterbury. If you don't know what AmeriCorps Prevention Corps is, I encourage you to find out. They are college level folks who are trained to work within an organization to address prevention, and some of them specifically opioid abuse prevention issues from a variety of standpoints, whether it's through data collection or providing training or working on curriculum. We have two that are housed at Waterbury Youth Services, one for Youth Services and one working with Health 360. There is a AmeriCorps Prevention Service member working with Staywell Health Center right now, so we're very, very fortunate to have this service program, and I was hoping someone would be here so you could learn about how to get an AmeriCorps Prevention Corps member in your agency, but let us know after today's event if you are interested, because they are recruiting right now for next year's service member placements. So with that said, we have our wonderful representative from Senator Joan Hartley's office to provide some opening remarks on behalf of Senator Hartley, and then we'll turn it over to our Commissioner of Demas. So thank you so much for getting here so quickly from Hartford to be with us. Ms. Coralie Stades, which is the administrative assistant, or legislative aide to Senator Joan Hartley. Thank you. Come on up.
Good afternoon. As she said, my name is Coralie Santana. I actually got married recently, but that's beside the point. Senator Hartley really wanted to be here today, but she understood that the conversation was vastly more important to be carried out. She, as we know, is in the legislative session. They have just been called it was 2:35 when they got called. So we expect her to probably be there maybe all night. We don't know. It's very unpredictable. The House of Representatives was in all night until about noon this afternoon. So it's very dicey this time of the year and very unpredictable. But she did want me to express that, this entire forum came about as a conversation that she and Commissioner Delphine-Rittman had through her appointment hearings. Senator Hartley also sits on the Exec Noms Committee, and we understand that this opioid crisis is something that affects all four corners of our state, and Waterbury is affected. But we understand also that there is a lot of effort here from our mayor, from our chief of police to take a hands-on approach and assist in any way we can. So this conversation is very valuable to us and to the community as a whole. So we really thank Jennifer and the commissioner and everybody for putting this together, because it took a lot of phone calls and email threads, and it has just been wonderful to see that all of you have taken time out of your days to be here today. So thank you so much.
All right, and I really tried to get the senator here, but she wouldn't play hooky today, so darn it. All right, so it is now my pleasure to introduce to you the Commissioner of the Department of Mental Health and Addiction Services, Marian Delphin-Rittman. Prior to her appointment, she held varied roles at the department, including Deputy Commissioner, Senior Policy Advisor, and Director of the Office of Multicultural Healthcare Equality. Under the Obama administration, Dr. Delphin-Rittman served as Senior Advisor at the Substance Abuse and Mental Health Services Administration with the Department of Health and Human Services, working on a range of policy initiatives addressing behavioral health equity, workforce development, and health care reform. Dr. Delphin-Rittman has also held positions as Assistant Professor and Director of Health Equity and Multicultural Research and Consultation with the Program for Recovery and Community Health in the Yale Department of Psychiatry. I got the privilege of hearing our commissioner speak at a conference at WestCon a few weeks ago, and I am so pleased and honored and excited to hear her tell us again about the things that are happening at the state level, because it really, to me, speaks to how we are staying the course. So please help me to give a warm welcome to our Commissioner, Marian Delphin-Rittman.
So good afternoon, everyone. I'm going to get situated here. I have my phone to keep me on track, to make sure I don't go over. I first want to just pause and say a special thank you to Jennifer DeWitt and HVCASA for helping to convene this. Also Mayor O'Leary for hosting us today, and for all your just hands-on work with making this a priority. Appreciate and just applaud all the work that you're doing. We were talking earlier, certainly feel free to continue to reach out anytime you need to, and so we're certainly interested in continuing to partner. I also want to thank Senator Hartley. I know she's not here, but in her absence, at my hearing, we had a discussion afterwards just about how we know that it takes a village. It takes all of us working together. And so we had a discussion around, why don't we get folks together and just do an update around the range of new initiatives and new collaborations that we have going on. And so that's some of what I'll present, just to be able to update you on some of the new areas of work. So I want to thank everyone for being here. I often say that it takes a village, and I see many providers that we work closely with, many individuals that we fund, and so certainly appreciate your partnership with us and your being here as part of this discussion and the work that you're doing here in Waterbury and elsewhere around the state. So I have a number of slides, but I'm going to try to go through them quickly so that we can have discussion. I want to talk a little bit about some of the broader Connecticut data, and then I'm really going to focus on some of the initiatives that we have in place, again, as a function of our new SOAR funding, that's the State Opioid Response Grant, and some other SAMHSA funding that we've recently received. So in Connecticut, when we look at our DEMAS data, we see that heroin and opioids remain the primary drug in admission when we look across all DEMAS admissions, but also when we look across just our substance use admissions. So people who are coming to treatment for substance use. Jennifer had mentioned earlier that, it's not just heroin and opioids that we need to pay attention to. And so one thing, when we look at our data, we see that alcohol is actually the second substance that people are coming in saying that they're struggling with. Marijuana it switches between the third and the fourth, but people come into services reporting difficulties with that as well. I think I did something I wasn't supposed to do. Okay, there you go. Technology. So the other thing that we see when we look at our data, we've seen a slight decrease in terms of the individuals accessing services for opiate and heroin use. And so to us, I mean, one thing that we've noticed is when the national data and the Connecticut data has increased in terms of overdoses, the admissions into our system also have increased. We're seeing this decrease as a possible proxy telling us that, that there is a downturn that we're beginning to see. We're beginning to do town-by-town analyses, and it is the case that currently, again, projecting out to the end of the year, it may or may not hold. But Waterbury, at this point, is pretty level or maybe a slight increase in certain categories, depending upon how you look at the data. And so we're continuing to look at the data and do town-by-town analyses. When we look again at the chief medical examiner's data for the past year, again, we are seeing some decreases. That overall in 2017 there were about 1,038 overdoses. In 2018, about 1,017. That is a decrease, but it's still a lot. It still lets us know that there is a lot that we need to do. It's certainly going in the right direction, but the numbers are still way too high. And so we have been really just laser focused on this, as well as other substances we know as well, because for some individuals, and this table shows, some individuals struggle with polysubstance use, and so there are many other substances that are listed here. Just about every category saw a decrease except for stimulants. And so, there's work nationally around emerging threats. There's an emerging threat initiative, and we're looking to bring that here to Connecticut as well. Looking at data to be able to do some predictive metrics and predictive analyses around what might be coming. Just looking at the chief medical examiner data alone lets us know that there were increases in terms of stimulants, and so that may be something to look for, or to look at and to pay attention to moving forward. This is a similar slide. It just shows a visual of the steady increases that we've seen in terms of overall total overdoses. You'll see the difference in 2018. There's a slight, in terms of opioids connected to any death, that's a little bit less. In terms of fentanyl, though, we've seen an increase there. So we increasingly are seeing fentanyl involved in the overdose deaths that we're seeing around the state. So I'm going to talk now about what we're doing, because again, the trends are suggesting a slightly downward trend, but we know there's a lot more that we need to do. And so overall, in terms of the resources that we receive from SAMHSA, as well as our state resources, we're using a model that really is being used nationally. That is looking in terms of prevention, also implementing a range of treatment initiatives, and then also a range of recovery initiatives. We're also taking a multi-agency, multi-system approach, where there's collaborations across state agencies, numerous collaborations across community providers, and it truly needs an all-hands-on-deck approach. And so that certainly has been a part of our strategy. We started an access line about 2 years ago and have gradually expanded the offerings that are part of this line. Through the access line, which is available 24 hours a day, a person can call this toll-free number, receive an assessment, and if they need detox, we'll give them a ride to detox if they need a ride as well. One thing that I was hearing as I was going around doing forums around the state is that for some areas, transportation is a barrier. And so we don't want transportation to be a barrier to people accessing services. And so through the access line and this initiative, we'll provide transportation if an individual needs transportation to detox. Another thing that we're focused on is just increasing people's ability to access services. One thing we heard is that, often I would hear this, is that people had questions about how to access a bed, and often they didn't know where the beds were available or where the sober homes were that had bed availability. So we put together a real-time bed availability website that essentially lists, at any given day, it will list where the beds are available in the state. And not just detox beds. We also will list residential treatment beds, recovery houses, and as a function of legislation that passed last year, we'll also now list sober homes. only if they become certified. So if a sober home becomes certified, we'll list them on our website as well. The last column includes a timing, so the beds available as of. So the individuals going to the website will know essentially what beds are available that day up to a particular point in time, 9 o'clock in the morning, 10 o'clock in the morning, that sort of thing. The mayor talked a lot about awareness, and so awareness, I think, is a big part of this, a big part of helping people to know what services and supports that are available, to let them know about the availability of, what best practices are out there, also what different programs are available. So essentially, we launched this campaign. It's called the Live Loud campaign. The goal of it is it was targeting, or essentially targets, individuals who are struggling and their family members. We had worked with a contractor that did interviews and focus groups all over the state with individuals who are struggling, with their family members, with community providers, to try to develop messaging that would be engaging, to help people know that they're not alone, that they can, that hope is important. That they can reach out and receive help, and that recovery is real and recovery is possible. And so that's a big part of this campaign. You'll soon start to see billboards, advertisements on buses, radio ads. It's a multimedia approach, and the goal is to reach individuals who are struggling, but also family members and their loved ones, and to let them know of the availability of services and supports across the state as well. There's a website that goes along with this campaign. It's www.liveloud.org. And essentially that website, it's a website but can be accessed via the phone, a person's phone as well, and it's much like a phone, an app, a particular app. It contains information about how to connect to services, information about opioids, about different forms of treatment, about sort of strategies for family members. So it's really a wealth of information related to recovery and helping individuals access services and navigate the range of services that are available. Another thing that we've been focused on is increasing access to medication-assisted treatment and recovery supports. And again, the recovery supports, well, I'll talk about it in a bit, but it's the MAT certainly is for individuals who are struggling with heroin and opiate use. Many of the recovery supports are for individuals that are struggling with any form of addiction. I'll talk a bit more about that. But this map essentially shows the additional either MAT resources that were added or the recovery coaches in emergency departments and where they've been added around the state. Our approach in deciding where to stand up some of these services, we often will look at the overdose data and see where are the hot spots. So we look at geographic hotspots within the state, and then we also look for sort of are there particularly vulnerable populations within a particular area that we want to try to focus on or target. The thing that I find interesting about this map is the hotspots, and hence where we have located some of these services, coincide with some of the traffic routes. So 91, 84, and 95 tends to be where we see hotspots around the state. And so that, at least for the resources up to this point, we've targeted some of the new resources in those areas. The other areas have resources as well and have programs as well, but for the SOR, that was the new grant, this is where we targeted for that new initiative. Oops. So another thing that we've done is we have funded some MAT vans, so MAT vans that medication-assisted treatment vans that will go out within different communities to help bring information about services and supports to community members. Unfortunately, we know there's still a lot of stigma related to accessing services, and so at times individuals may not access services or maybe not be willing. And so our goal has been also to bring services to community members and to bring the resources and information out to individuals in the community. So essentially this van does that. It drives around Well, the van doesn't drive around, but people drive, So anyway, so the van, it's the acronym. But it's just one additional way to get information about what's available out to community members. There's also naloxone on board, and so the individuals are able to disseminate naloxone to the people that they encounter within currently this is in West Haven and also the Milford area. Okay. The other big thing that we've been trying to do, as we know, and the mayor and Jennifer mentioned this as well, naloxone is so critical in terms of disseminating this statewide. And so we've been working to get naloxone out all over the state. We recently ordered about 12,000 kits. All hospital emergency departments now have naloxone. Each of our regional behavioral health action organizations have naloxone. So here in Waterbury, Jennifer and the HVCASA are doing training all over around sort of Narcan dissemination, as well as giving people information about other services and supports if they're struggling. We've also given naloxone to Department of Correction, Department of Public Health, all DEMIS facilities, and so that will be an ongoing priority area. We'll continue to remain stocked with that and disseminate it as necessary. So one thing that I think is we're fortunate here in Connecticut, many pharmacies now have naloxone. There is a website that the Department of Consumer Protection has. You can go to the website, look at your town, and it will list where the pharmacies are where naloxone is available. This is real time as well, so it has the pharmacies listed that currently have the naloxone on site. So I think that's a valuable resource. Another multi-agency collaboration is around medication disposal. So the Department of Public Health, Department of Consumer Protection, DEMIS, has been actively involved in essentially letting people know where the drop boxes are around the state. And last year alone, 43,000 pounds of unused medications were collected. And to me, that is just astounding. That is a lot of medication that's been collected. Because we know one pill weighs close to nothing. So 43,000 pounds, that's a lot of unused medication. And it's been wonderful to see those numbers go up. I remember several years ago it was 41,000 pounds and 42,000 pounds. So increasingly more and more medications are being turned in to the police departments. Each of the police barracks have them. And so it's been important to see these numbers rise. We know for many individuals, they talk about how use for them started with the pills, and then heroin, and then other synthetics for some individuals. We also know, we often hear that this is not an issue that we can arrest our way out of. And so we have a series of collaborations with the Department of Corrections and the Court Support Services Division, where we now have medication-assisted treatment available within a number of correctional centers in New Haven, Bridgeport, as well as Osborne and Corrigan. We also have a program called the Treatment Pathways Program, where individuals who pre-release are connected with individuals in recovery or case managers who can work with them to help them get connected to services and supports once they're released. And so this is important as well, because we know that that's a vulnerable population. A lot of the data has shown that individuals who have had previous corrections involvement, if they go back to previous usage levels, that it makes them vulnerable for overdose. And so that's one area that we've been targeting some of our resources and programs. I'm going to go quickly through these last few. Another initiative, and sometimes the thing that I love is I love sort of being out in sort of meetings and programs like this, because this is where some of our most creative innovations, I think, have come from. The ideas, I mean, again, it goes back to it takes a village. The idea for this initiative came from CCAR. We were at a meeting. After the meeting, the director of CCAR, Phil Valentine, said, Commissioner, I've got an idea for a program that I think will make a difference. I think this will really make a difference. And so we were able to find some resources. We did a small pilot with initially just four hospitals. And within a short period of time, the number of individuals that the recovery coaches connected to the hospitals certainly made me aware that this is something we need to expand as soon as we're able to get resources. And the timing was was wonderful, really, because then we started to get the STR, the State Targeted Response Grant, and then the SOR, the State Opioid Response Grant. So now we're in 14 hospitals around the state, and the recovery coaches are their work is really inspirational. They help to give people hope and help them to see that, you know what, recovery is real, it is possible. They help to link people to services and supports. And so the work that they've been doing really is valuable. And the data shows that an interesting thing is they're connecting more people with acute alcohol intoxication and who have ended up in emergency departments as a function of alcohol use, more so than opioids. And other substances as well. You see alcohol, marijuana, and then OS is a category of other substances. So we've been really pleased with this initiative and have continually increased it as we've been able to secure federal funds. Another innovation that we have going on in Bridgeport, Hartford, Waterbury, and New Haven is the Imani Breakthrough Program. This is it's a church-based initiative, not necessarily faith-based, but it's a church-based initiative that is culturally and spiritually and trauma-informed and focused on recovery. And it essentially is a series of groups where people sort of share their experiences, where information is given about services and supports that are available, Narcan training. And so this is an initiative that we're looking to expand as well. How we can help. This is also a new initiative that we recently funded. It's essentially community organizations that have come up with innovative ideas. For example, in New London, anybody that has overdosed, the officers give their number, give the individual's name to the city. The City of Waterbury has a team of navigators that they're working with, and the navigators will follow up with people to try to connect them to services and supports. And similar to the recovery coaches, their connection rate is up in the 90s. And so the role that people in recovery and the hope that they've been able to give people has been really impressive. And so those are initiatives that we certainly look to fund. Another initiative in the Newington area on the Berlin Turnpike. You know, there's a series of motels on the Berlin Turnpike. The team in the Newington area is working with the hotel owners and the motel owners to give them information about services and supports, to supply them with Narcan, to give them information about other, like just a range of services that are available across the state in terms of mental health and addictions. So that's a creative innovation as well. So this is an area, so employment. We've also been looking to bring employment specialists and having them work in recovery houses and in each region of the state. And the key thing with this is we see this within the mental health literature and work. There's a lot of discussion around how employment services that is a best practice. Connecting people to employment often helps people move into long-term recovery. So this just made sense. It made sense to implement this within recovery houses as well. So it's essentially an employment specialist that will go to recovery houses and help to connect people to different employment opportunities. And so those are each of the regions of the state that have those. And then there are just a range of prevention initiatives that we have planned or ongoing. Again, lunch and learns, dissemination of the Live Loud campaign, dissemination of some of our collaborations with other agencies, and so prevention has been a priority area as well. So those are just some of the new things that we have going on that are new. It's not everything, but just wanted to give you some examples of some of the new initiatives that we have going on to address this. Certainly, we are always looking for creative, innovative ways to connect with people and help people move into long-term recovery. And so I'm looking forward to the discussion that we'll have later on. So thank you.
Thank you so much, Commissioner. I just wanted to take a second for folks who are in the back. If anybody wants to come and take seats up front, you're welcome to do so. It's not like being in the classroom. No one's going to ask you questions. But we want you to come and have a seat if you'd like to have a seat. While we now, thank you so much, introduce our panelists. And we're going to ask folks to hang on to your questions because there's a lot of good information. I saw a lot of people taking notes. That's wonderful. We have a mic here. We want to give you an opportunity to share your ideas and your thoughts and your quandaries with us, and also to encourage folks, if you did come in late, please talk to people after the event as well. At this point in time, I would like to introduce to you our first panelist, which is Dr. Sheila Cooperman, who is the Medical Director of Western Connecticut Mental Health Network. Dr. Cooperman works with clinics in Torrington, Waterbury, and Danbury. She is board certified in adult psychiatry as well as addiction psychiatry. Before coming to Western Connecticut Mental Health Network, she was vice chairwoman of the Department of Psychiatry at St. Vincent's Medical Center with campuses at Bridgeport and Westport, where she wrote the protocols for initiating Suboxone. I didn't know that until I read your bio, doctor. For nearly 20 years, she treated patients at Silver Hills Hospital, inpatient and outpatient, who were struggling with addiction, guiding them through detoxification if necessary, treating them with medication-assisted treatment. She was service chief for the adolescent and eating disorder services for more than 10 years and used Suboxone with adolescents when needed. Dr. Cooperman has published several articles and book chapters on addiction, and I just have to say, when she first asked if she could come to our opioid work group meeting, she was so just genuine and had a lot of great questions, and I said, Doctor, do you think we could talk about this, and do you think we could do that? And she said, oh yes, let's do it, and oh yes, let's talk about that. And boy, you know, what a nice welcome to meet someone who is so collaborative and like-minded. So I'm really pleased to have you on our panel. Thank you so much. And just make sure that when you talk, you please have the microphone in front of you so we can pick you up on our auto recording. So thank you, and please help me welcome Dr. Sheila Cooperman.
Thank you very much for that introduction. How's the microphone working? Can everyone hear me, or is this better? What do you think? How's this? Is this better? Is it on? It's on. So, can you hear me back there? Okay. So, I know, Jennifer, thank you so much for that very kind introduction. So, the reason that I came here today is to make sure that people knew what we're doing at Western Connecticut Mental Health Network. Now, you know, we're state-operated clinics here in Waterbury, Torrington, and Danbury. And what we started several years ago is making sure that all of our staff were trained in the use of Narcan. And we have Narcan kits at all of our clinics. Our community workers have Narcan when they go out into the community, because it may not be one of our clients who needs it, but it may be someone else that we encounter who may need to have Narcan be available. What we've also done is included family members of our clients who may be struggling with substance use disorders. What we wanted to make sure that we knew is that of the 1,000 clients that we treat across our network, that we were sure of, as sure as we could be, of how many people were struggling with addiction or substance use disorders. So what we did is we did chart reviews, and we looked at all of our client population and discovered that more than 60% were struggling with a substance use disorder. So what to do next? Well, let's take a look. In the middle of this opiate crisis, how many people are at highest risk of an opiate overdose? So what we found is about 7% of our clinic population had opiate use disorders. We wanted to drill down to make sure that that was really true, that are we missing anyone? So we did look at charts individually, spoke with a number of our clinicians, and what we also did is, rather than sending urine drug screens out to a lab for confirmation, we began doing drug screens here and now in our clinics, so that we'd be clear that we didn't miss someone who may have been using opiates and either didn't want us to know or they didn't want to admit that they were using opiates, so that we could cast a wider net and make sure that we were offering the kind of treatment that they really needed. So with the drug screenings, with the Narcan, then we educated our staff about the use of medication-assisted treatment. And what Jennifer was saying is really true, and that's that, we know that a large number of our clients are struggling with alcohol, for example. So all of our prescribers, and we have 14 of them across our network, all of them are able to prescribe Suboxone. So we have that service as well as addressing people who may have other substance use that they're struggling with, like alcohol. So we have Narcan as well as naltrexone available either orally or by injection that lasts about a month. If someone is using methadone in their drinking, then we can have people be on Camprol. If they're smoking cigarettes, which is really one of our most common drugs of dependence, we've got nicotine replacement treatment. We have varenicline or Chantix available. We also have Wellbutrin that we can prescribe. And what we also want to make sure is that that our clinical skills are up to speed and that we can really appropriately intervene with the clients that we work with. So we started an ESPERT project, and this is still ongoing. Some of you may be aware that at the federally qualified health centers, screening, brief intervention, and referral to treatment was one way to pinpoint people who may need an intervention for substance use. So we thought, well, maybe we can adapt some of those procedures to our clinics. So we partnered with UConn. We had their ESPERT team come down and train our licensed clinicians in enhancing our screening of tobacco, alcohol, cocaine, marijuana, and opiates. Our IT support was able to calculate a score that someone would get, and that would help us direct whether or not we do a brief intervention or refer people to other higher levels of care. What we provide certainly here in Waterbury is relapse prevention groups. We have other groups for people who may have more severe mental illness. We've been able to enhance our skills in all of our sites, so our clinicians are more aware of what you need to ask for, what kind of scripts you need to work with a client in order to get them to a different level of care if they need it. And we also provided lists of 12-step meetings because we really want to make sure that the full community gets involved. So one last intervention that we've done more recently is incorporate auricular acupuncture. Because we have a number of clients who are on medications for psychiatric illness as well as for medication-assisted treatment. And so is there something else that we can provide that doesn't add additional medication? So fortunately, the Women's Consortium in grant funding with DEMAS was able to provide about a year ago this type of treatment intervention. So what's involved is that we have licensed clinicians who can use between 1 to 5 needles in someone's ear. It sounds more painful than what it is, but it really has been supported by research. Yale and Connecticut Mental Health Network has been using auricular acupuncture in their clinics for more than 10 years. So we thought, well, maybe we should do this too. So fortunately, we do have groups that are ongoing, and you can use between 1 to 5 needles. It's very relaxing, decreases cravings, increases, people's ability to make use of their recovery programs, and decreases their relapses. So actually, this was so successful that we coordinated another training where we had another 20 therapists be educated in auricular acupuncture as well. So that's kind of a brief overview of some of the initiatives that we've made over the last few years in combating the opioid crisis.
Dr. Cooperman, I don't know about you, but I think that people could have listened and listened and listened to some more. I'm sure there's some questions about auricular acupuncture. And although I have never personally experienced it, I have heard from people who have tried the technique that it is very effective. I know it sounds different, but I've heard it is quite effective, not from firsthand experience. So thank you so much. Our next panelist is our Chief of Police for the City of Waterbury. Fernando Spagnuolo joined the Waterbury Police Department in July of 1992. During his tenure, he has served on the Patrol Division, Motorcycle Unit, Tactical Narcotics Team, Vice and Intelligence Division, Extra Duty and Licensing, and as an aide to the Chief of Police. He has also participated in several projects and investigations with both the state and federal departments of Homeland Security, and his list of accolades and experiences goes on and on and on. What I can say about Waterbury Police Department is, for me and the work that I do in prevention, we always try to express and help people understand how, while law enforcement is just that, it's enforcement, they're also a really, really important partner when we talk about prevention, because most of us in this room have no impact on the availability and presence of illicit drugs in our community. That is enforcement. Our job is to do primary education, awareness raising, refusal skills with youth, communication skills with parents and families, and all those kinds of pieces, but we very, very much need our law enforcement partners to keep our community safe. They are also an integral part of underage alcohol sales compliance checks, tobacco sales compliance checks, and one of the things that I've noticed over the past few years is Waterbury Police Department's Community Relations Division. You guys are rock stars. I think that I have seen so many changes in this community because of the efforts that your Community Relations Division has undertaken in the past few years, and I'm just so proud to work with you in your department. So, Chief, thank you so much for being here, and I'll turn it over to you. And before I do, I have been scolded multiple times. That microphone needs to be right in front of everyone so they can hear it and it can be picked up on the recording. I don't want to be scolded again. Face in front of the microphone. Thank you.
How's this day? Good day? All right. There's not much more to say, Jennifer, with that introduction. Thank you all very much, and I really appreciate the opportunity to come here today and talk on this panel. It is about collaboration. The law enforcement end of it is enforcement, but we also recognized early on in the Mayor's Task Force and working with people like Jennifer and the City Health Department and Adam Renko, our Emergency Management Director, that we weren't going to rest our way out of this issue, that we were going to have to do a lot more, and we were going to have to partner, and we were going to have to work closely with the social service and the mental health and the addictive service providers in our community to try to combat this opioid crisis. And we've taken that very serious. Drug take-back, the Commissioner had mentioned drug take-back and a tremendous amount of pounds that get collected throughout the state, and I'm always impressed with the fact in Waterbury, we collect 12 pounds of narcotics that are unused in our collection box every month in the police department. We participate in the DEA drug take-back days in 2019. Above and beyond the 12 pounds a month that we collected an extra 18.5 pounds and a ton of fentanyl patches. In 2019, we did about the same amount. Our community relations department is always conducting presentations, working with the FBI, community outreach, Chasing the Dragon. I'm sure many have heard of that. It's an opioid-related education program that we brought into the school system here in Waterbury in collaboration with the U.S. Attorney's Office. We recognize it's important to do this outreach and to make sure that the most at-risk people that we're dealing with know that there's help available out there. We're cops, we're not marketers, so it's great, and we're not social service, we're not counselors, but it's great to have those people available with us. Jennifer comes with us every month. Anybody that gets released from prison and gets on probation and parole back in Waterbury comes to a meeting with me, the state's attorney, the U.S. attorney, Jennifer DeWitt, and some other social service organizations. And you know, we welcome them back to our community, and we understand how difficult it is for them. You know, that they were incarcerated for a while. They may be on a methadone or some sort of maintenance program when they were incarcerated, and they may not know where to go when they get back to the community. So we make sure that we have the resources that are available for them to support them, so they don't end up in a situation as they did prior. You know, on the fun part for me, the enforcement end, right? We talk about that, and you know, I don't like drug dealers. I spent 2/3 of my career, you know, writing search warrants, knocking doors down, and locking these people up, and making sure I followed through the case until it was adjudicated, and hopefully they were in jail. They destroy our community, right? It's not just the fact that they're dealing drugs; it's all the other impacts. It's the victims that they create along the way. It's the violence that comes along with it. It's the way that they rip families apart, and it's devastating to me. And you know, we take a very aggressive approach to drug dealing in the city of Waterbury under this administration and under the mayor's administration. And above and beyond what our street crimes units and our vice and intelligence detectives are doing on a daily basis, we've run a number of different operations, you know, over the course of the last few years. I'm just going to outline some of them and tell you about some of the minor details of them. Operation Stamp Out occurred in 2016, where we arrested 55 opioid dealers in the city of Waterbury that sold to undercover police officers. We seized over $27,000 in currency and over 2,000 bags of heroin for street sale. In 2017, we conducted our Operation Market Crash with the state's attorney's office and the statewide narcotics enforcement division of the state police. In that particular investigation, we seized 5 kilos of heroin, 5 kilos of fentanyl, and $40,000 in cash. In 2018, Operation Second Chance, 9 ounces of raw heroin and some marijuana. In 2018, again, Operation Round Trip, 1 kilo of cocaine. And then in 2019, most recently, with our partners over here at the end of the table, the Naugatuck Police Department and the DEA, we endeavored in Operation Common Knowledge, where we arrested 36 targets. We conducted 11 search warrants in Waterbury and Naugatuck, and we seized 8 kilos of fentanyl, 5 kilos of heroin, and 2 kilos of cocaine. So there is a massive amount of drugs that are available in this city, right? This is Waterbury, 110, 15,000 people. This is a massive amount of drugs, and this is what we're finding. So, you know, the pressure will keep up. We've got great partnerships regionally. We've got great partnerships federally. But, you know, I'll go back in full circle to where I began. You know, we know we're not going to arrest our way out of it. We know that's just one component. It's truly about the collaboration, and I appreciate all the efforts of Jen, our city health department, the state health department, and Demas, and the support we get from Adam Ranko on the fire and emergency management side, and of course the mayor's task force. We really appreciate the assistance we get there. And we're just going to keep going. We're going to keep working and do the best we can. The Narcan availability that you talked about, to us, is amazing. You know, our officers are getting to the scene, and firefighters are showing up at scenes now on overdose calls, and you know, people are actually brought back to life because a loved one's had the ability to administer Narcan prior to our arrival. You know, the scary part about that, and we've talked, Dr. Jacoby and I, about it a number of times, is people are actually getting Narcan and not going to the hospital to get checked out afterwards, because there is that potential that they could overdose again, depending on how their system is you know, getting rid of the drugs. So, but all in all, I think it's a good thing, and that's a really good effort going forward. Another thing that we've been doing is working through community relations in PAL, trying to do a lot of health outreach, working with Cigna. We're bringing a Cigna health screening van to inner city communities, and encouraging some of the people there that may not have access to health care to take a step up to the health van. We also partner with other social service, mental health, and addictive agencies when we bring that health care van to these communities, so there's information available about, you know, substance abuse, the availability of Narcan, and everything else they may need. So we're just going to keep the fight going, and I appreciate your time. Thank you.
Thank you so much, Chief. I'd like to introduce our next panelist, who she's super busy just like me, and sometimes doesn't always make good choices just like me, because I said, here's this event, and while there's finals going on at Naugatuck Valley right now, Dr. Sandra Valenti was like, yeah, I'll be on that panel, sure. But I think that also just speaks to the fact that, no matter what's going on, it's always time to have this conversation. So Dr. Sandra Valente has been a professor at Naugatuck Valley Community College since 1998 and program coordinator for the Drug and Alcohol Recovery Counselor program there for quite some time now. She is certified as a clinical supervisor, master's level addictions counselor, licensed alcohol and drug counselor, and licensed professional counselor. And she also holds certifications in trauma counseling, guardian ad litem, and EMDR. She has a number of other accolades as well. They are all in your packet. But one of the things I was so excited to have her come here and talk about, which I know she'll spend a few moments on, is a recent conference that she had on the intersection between opioid use disorder and opioid crisis and trauma. And in case you didn't know, I go to trauma conferences, or not trauma, but opioid abuse prevention conferences and forums and stuff all the time. And unfortunately, a lot of them are very, very similar. It's the same information over and over and over again. And I didn't really know what to expect, but having seen the agenda of Sandra's, I thought, this looks really good and interesting and different. And it was. And first of all, it was a packed house. Second of all, Dr. Peter Jacoby was one of our speakers, so that just made it all the worthwhile. But what was really important was the conference participants talked about topics that are not typically talked about at other kinds of conferences. And the panel of speakers that Sandra coordinated just really spoke to some of the different parts of the opioid crisis that sometimes hang out in the shadows and in the periphery. And one of the things that she made sure folks became aware of, if they didn't already know about, was ACEs, adverse childhood experiences, and how they impact trauma and addiction and other problems that people experience. So I'm so glad to have you here today, Sandra, as a colleague, as a regular participant in our opioid work group. Without further ado, please help me welcome Dr. Sandra Valente.
About what's been going on at the college, but a little bit, one of the things that I've been thinking about listening to all the speakers is it's kind of interesting for me. I wear, in addition to being busy, I wear 3 hats. There's more, but sitting here, I'm a person in recovery myself from opioid addiction. And so when we talk about all this stuff, one of the things I think about is thank God that when I was using fentanyl wasn't on the streets, because I probably wouldn't be here. And being a clinician as well as a professor, I'm teaching students to be addiction counselors. And so I'm also contributing toward getting people in the field to work and help people who are struggling with addiction. One of my students is here, graduated from our program. So 2 years ago, and I thank Jen for this, she actually pointed out that, hey Sandra, there's a grant that's out, for to promote opioid awareness. She sent it to me, I believe, on a Wednesday, and it was due on Thursday, and I was able to get it in, and I wanted that grant. And thankfully, we were awarded the grant through statewide Healthy Campus Initiative. It was created by DMIS in partnership with 25 institutions, higher education across the state of Connecticut. The focus is on raising awareness, it's on education, it's on getting Narcan out there as well, reducing stigma, and I was right there and so thankful. I was ecstatic that I had gotten this grant. So I'm now finishing up in the second year. They awarded a second round $10,000 grant, and I was just informed 2 days ago that they are now awarding $20,000. We'll be getting $20,000 towards continuing these initiatives. Thank you very much. In a much shorter period of time, so I'll be allowed to continue all of these efforts, which I'll talk a little bit about now. So the goals for Naugatuck Valley with this grant really were about reducing stigma. We know there's stigma. It was to get Narcan on campus. So we've been doing monthly Narcan trainings. But one of the things that I've done with the Narcan trainings is that I've turned it also into a workshop where I'm not just talking to you about Narcan. I'm not talking to you about how it works. I'm also providing individuals with education about what is substance use, how do you recognize the signs. I've been very surprised by the number of individuals, students, first of all, who don't even know that there's a crisis or misinformation about what drugs are or what they're not. Access to treatment, you know, I see that in my private practice, but helping connect them to treatment. And talk about that as a component of the Narcan training. We also present statistics. I present the DEMIS bed locator website, which incidentally, that also is had a lot of meaning for me right now, because yesterday I had a former student contact me and say she needed help, private practice. She goes, I need detox. I said and in her head, this is what happens when you're struggling. In her head, she only focused on one agency. And her thought was, I need to get in, and they told me it's going to be 5 days. Keep calling, keep calling. I said, oh no, I can tell you where the beds are open. I pulled up Demas's website, and I said, there's 5 beds open at Blue Hills. She's on her way today. She sent me a text, and it was just a beautiful thing. And it's that website that allows that to happen. You can just find it at any time. So educating students about that. Part of our grant, again, the money that we got, we had to come up with all sorts of things. One of the things I developed was a list of a variety of all the different treatment resources, agencies across the state of Connecticut. And there's just not enough paper because there's always more I have to add now as a result of what I've learned today. But the other thing that I add at the bottom, which I think is important, is that individuals struggle with often with how do I use my insurance, not knowing how to use the back of their insurance card, and that often is a barrier for individuals to get into treatment. And so I included that, navigating your insurance and how to go about doing that. So I distribute this, and the good thing about it is that this is distributed to our counseling staff, all of our students. It's put up on our college website, so these resources are readily available. We also I designed these little cards, which I think are helpful. Again, a smaller version of treatment, how you access treatment for immediate help. I have the DEMIS bed locator on there, but also signs of opioid overdose. As a part of our Narcan trainings, we're distributing this with what are the signs and how do you administer Narcan to reverse an overdose, and things that you could say to that person. We're also, through the grant monies, distributing the medication disposal bags. As you know, there's medication, just educating people about, when I'm in front and doing the workshop, like, your grandmother or your friend, what are the tendencies of adolescents? They're going to go through your friend's medicine cabinet. There's farm parties. You show your house, for example, if it's up for sale. We need to get medication that's not being used out of our homes and disposal, either through the drop boxes or through the use of the disposal bags. And so just making them more aware of this availability as well. We do a regular drug and alcohol education day, campus-wide. We actually screen all the students who come through. We do a DAST on them, a MAST, most discussion, and then they're also educated throughout that time about the different substances and abuse treatment options, and lots of things that we can take away. The conference was unbelievable. That's all I can say. It turned out to be more than I thought it would be. There was not enough room to accommodate the number of people who were asking to attend that conference. It was called the intersection between trauma and addiction, and actually got from Jacoby, and we also had Adam, who was also one of our panelists. The focus was of the panel discussion there, which I think is important, we haven't touched on a little bit here, is this crisis is not just impacting on the person overdosing, or it's impacting on the families, but it's also impacting on our first responders. How many, you heard the statistics, how many people are, how many was I really down? Because I use it for teaching when I go back. The number of Narcan uses, that EMS provider, that's going to start affecting you when you're coming upon somebody who's passed away, and that affects our EMS, our police, our fire, it affects all of us. And so the purpose of that panel was to process that. what do we do with families after an overdose? And it's so great to see some of the newer initiatives where you're providing support. So we were able to do that. But one of the highlights, when I look at the feedback from this concert, is I showed the film, The Biology of Stress and Science of Resilience, which focused on ACEs, adverse childhood experiences. And one of the most important things that comes from this is that it's evidence-based, and there are new initiatives where we need to start looking at our children, and one of my recommendations, we need to start screening our children at a young age. And if they have a high ACEs score, we need to connect people, provide them with supports, visit them in their homes, get those children into treatment so that because we know with high ACEs scores, those are the individuals who have chronic stress, develop illnesses and addiction, and there is that direct connection to addiction. So that was one of the very positive things that came out of that as well. As far as some of the issues that I think that we need to address, one of the things that I've seen a lot of in private practice is kratom. Just last week I walked into, I think it was like a gas station, and to see kratom on the shelf was shocking to me. I have a client who was addicted to it. It's an opiate-based substance from a tree in Thailand, and it does cause the same types of issues that we're seeing with other opiates. So I think that's something that needs to be addressed legally whenever we can do, but be aware of it. It can be how to harm people. It's just another problem. Also educating individuals. One of the things that comes out of the Narcan trainings, when I have students in front of me, I talk about the fact that our dealers are very smart. They're using fentanyl because it's so cheap to cut with other drugs. When a person, the focus when we think about the crisis is on opiates, but people are going to use cocaine, or they're going to use a benzodiazepine and find themselves in a hospital and say, what happened? I was just going out to use cocaine. That's another issue. It's just about awareness and working with individuals to make them aware of the fact that that's there, and giving them test strips as well. I think we still need to work on the stigma. There's still a lot of people who won't go into treatment because of stigma. Also, criminal justice system. I know we've made a lot of efforts. I met with Geraldo Reyes, our representative here in Waterbury, because I've been advocating a lot of work in the criminal justice, however way they get in. And I know we're doing that now, but continue that treatment, MAT treatment. If there's any connection with substance use, put them in treatment, give them that. But also continue that care when they leave. Often when a person leaves, there's that disconnect, and then the cycle starts again. So what can we do to continue to keep those connections going with treatment providers? We need more adolescent and child psychiatrists who specialize in addiction, co-occurring disorders. Sober schools, very effective. There are colleges now. I know Southern has sober dorms. There's need for more sober high schools across the state of Connecticut. We are along I-95, 84, and the drugs are coming up to our state. So we need more sober schools to help those people stay sober. Recovery coaches, we need more. We need to support any efforts to keep them in the emergency rooms. And with that, that is it. Thank you.
Thank you, Dr. Valente. And I think it's important that you have so many different areas to share about, because she is so knowledgeable and she does interact with so many different community sectors in her work. So thank you so much for sharing those recommendations about what we still need to continue to stay the course. Dr. Peter Jacoby is our next speaker, and he is the chairman of emergency medicine at St. Mary's Hospital in Waterbury. He's past council speaker for the American College of Emergency Physicians and assistant professor at the Department of Traumatology and Emergency Medicine at the University of Connecticut School of Medicine and at the Department of Medicine Sciences of the Frank H. Netter School of Medicine at Quinnipiac University. How'd I do, doctor? He has a lot of other awards and recognitions. And he's another one of my favorite people on this panel. Pretty much everyone up at that table is. So without further ado, Dr. Peter Jacoby is going to talk with you about recovery coaches in the emergency department at St. Mary's Hospital. Thank you.
Thank you. I promise I will get to CCAR in a second. I just want to follow up on a couple of things that were just said. You know, we in the emergency room, just to give you an idea, I walked in from my shift this morning at 5:30 in the morning and looked in and saw the trauma bay was a mess, stuff all over the place. My doc came out and said, whew, that one was a tough one. There was an overdose who was found in some bathroom somewhere who had then vomited and aspirated all that and had aspiration pneumonia, probably pulmonary edema related to the drug and everything else that had gone on. And he was fighting like the devil just to maintain his oxygenation. So that was the start of the day at 5:30. Literally at 2:45 coming over here, I had signed out my last few patients, one of whom was an overdose, one of whom was an alcoholic, 2 others who were depressed but on opioids, and you start to see what it's like in the emergency department. Now in that discussion that we had at Naugatuck Valley, one of the things they asked me to talk about was the intersection of trauma and opioid addiction. And it is not just getting too many medications. There is a real brain issue that goes on in the trauma victim that affects certain parts of your brain that makes some people crave more the opioid and the need to have the opioid to take away issues that are going on in the brain. So we need, you're right, more psychiatrists, more help on that basis. I was just in Washington, D.C. this week with the American College of Emergency Physicians, talking with our congresspeople and our senators and their staffs about the need to fund more for adolescent and child psychiatry and adult psychiatry. The emergency departments across this country are overflowing with people in need of help. I will talk about CCAR now because it's one of the new things that we're doing. But understand that opioid addiction is not just too many prescriptions written by docs. No offense, 20 years ago, we were graded on how well we treated pain. One of the questions on the surveys was your pain treated adequately? And if we didn't get a good answer on that, then the government didn't pay us as I did. So now the government turned around and said to us, stop treating all this pain. So it's been a paradigm shift for everyone. There is a bad effect from stopping writing scripts. We embraced wholeheartedly a maximum of 12 pills. Because if you have a fractured ankle, you may really need some pain medication. You may really say, this hurts, and I get it. Usually 3 or 4 days I can get you past that severe pain. So we embraced writing it all. What we have not come up with yet in society and in medicine and everywhere else is the chronic pain individual and how do you treat that person. You can't just say, okay, stop all these meds. And to anyone else, once we stop some of these opioids, where did they go? To the cheap stuff on the street, called heroin, called fentanyl. And that's why we saw an incredible rise. So we're trying to tackle this problem on all levels. And in the emergency department, we look at it on every level that we can. What we have added on through the help with the state and others, and which is what they really asked me to talk about today, is the CCAR program, which is really Connecticut Community for Addiction Recovery. And it is trained recovery coaches who can come into the emergency department and work with the patients and their families. It's about a 30-hour program that people get trained in. But it allows us that I can say to a patient, all right, if you're going to give me 2 hours here, can you hang with me for 2 hours and I'll get someone in who can really start to work with you. Maybe get you into an inpatient program if that's what you need. Get you the ride, get you the other services, and potentially hook you up to an outpatient facility if we deem that the best. Now I'm lucky, and we're lucky, because I do a lot of work with Wellmore. I do a lot of work getting some of my addicted patients into their program right away. And yet, I'm on their board, and I heard Chris Young, child psychiatrist, who said something that frightened me. He said, you know what you don't realize is even the person now in recovery for 2 years, driving by the street where they bought the drugs, sends a stimulus to them. That's almost like a magnetic pull that says, come back to me. Come on back, we're still here. So it's not the physiological need, it's the psychiatric need. That pull that says, you know, every time I stopped at that corner, I bought drugs. And I can't go to that corner. I gotta make a right turn quickly, or a left turn, or back up, but I gotta get out of here. So what we try to do, and honestly, I wish I had the time to spend 2 hours with everyone. I don't. I'm so busy running patients and trying to give them all the time they need, that this program has allowed us for individuals to be able to call in a coach or somebody who can say, let me help direct your care. The first thing I always say to any patient is, will you give me the 2 hours to get them here? They're not going to drop out of the sky. It's going to take a while to get them motivated, to get them in the car, to get them here, to make sure you're then in the program. If you walk out, you're ruining it all. So give me those 2 hours. Nothing is automatic. But if you give me that, we can then potentially enroll you in a great program, get you a prescription pad for recovery, get you someone to call you, get you someone to work with you, and get you the proper follow-up. So it's just one of the things we've added on to our treatment modalities. We use a multitude of treatment modalities for anyone who comes in and wants help. The fearful thing for me is the number of people I see returning every day. Just before I left today, I admitted a patient. This patient has probably, I've seen, no exaggeration, 25 to 30 times for asthma exacerbation. Every 10 times she gets admitted to the hospital. Spends 1 day there, starts to breathe better, walks out, smokes crack cocaine, and bounces back. And had been there 5'7", 5'8", 5'9", or now today's 5'9". So it was 5'6", 5'7", and 5'8". Was there last night. Got discharged, came back this morning, couldn't breathe. I said, all right, I gotta put her in. And I'm begging her, saying, please, we'll get you the help. You've got to get off the crack. One of these days, you're just not gonna make it. And you gotta hear it. So understand that those of us in the medical field are 100% behind this. I have been in this room in the past. I have done with Adam. We started this Narcan on Fire EMS. We were the first to push for it. We got the fire department involved and all those EMTs who respond, and they are using Narcan. We are giving Narcan out in the emergency department. We are writing prescriptions for Narcan. We are doing whatever is possible to save any more lives that we can, and now get them into recovery. With that, I'll stop, and later if there's questions, I'll be happy to answer. Thank you.
Thank you so much, Dr. Jacoby. I know I've been a not great panel moderator because we are very behind on time, but we also went to a late start, and then we had Senator Hartley's aides, welcome as well. So we're a little behind schedule, but we're going to catch up. I know we're going to catch up, and we're definitely going to have time for questions and discussion. So without further ado, I'd like to introduce you to Blake Browder, who is from MCCA. He is a licensed professional counselor with the Treatment Pathways Program, which Commissioner Delphin Rittman has talked to you about already. So I thought it would be really important for Blake to talk with you this afternoon about their program, which the newest location for their program is right here in Waterbury. So again, a service that we didn't have 3 years ago that's here in our part of the state right now. So without further ado, again, his biography is in your packet. Blake Browder.
Thank you so much. It's a pleasure to be here. So as Jennifer said, I'm currently working in the Waterbury Courthouse, right down the street, primarily in the bail office, where I do clinical assessments on clients who, typically they're arrested the day before, and the bail office would then go screen them, and I go back there and do a full clinical assessment, and my goal then is to give them the same day treatment, and it could be detox, residential treatment, outpatient. It's kind of meeting the client wherever they're at. I started this program in Torrington 2017, and came over here to Waterbury in 2018. And some of the changes I've seen in the clients has been truly amazing. From basically having nothing to completing, say, a year of treatment and becoming a recovery coach, which is one of my clients, and told the true story. I have an article if anybody at the end would want to come see it, but it's been really fascinating to be in the courthouse as a clinician, where being sort of that old school approach, and frankly being welcomed. It's been amazing to from the public defender's office to state's attorneys to bail, probation. I get referrals to see clients, and that it's been one of the most amazing experiences I've had is to see the change, and I'm just so grateful for it. But it is a tough program where if a client is to leave treatment, is not compliant for public safety and for the client, I do have to redocket the case. So that's kind of where that close relationship with bail comes, and I can see Ralph nodding his head where you get a client of mine who back in the day who was doing so good for a while, but eventually it didn't quite work out, so he wasn't ready. But I do have some numbers that I thought would be really fascinating to share real quick. Currently there's 4 TPP programs in the state: Waterbury, Torrington, New London, and Bridgeport. There's currently been since March, Bridgeport started about 2015. There's been 1,141 screenings, 566 total admitted. 74% of clients who are admitted to treatment, it's in one day. So it's rapid admissions. That's the goal, because like someone said earlier, you do that outpatient referral, they might not make it. It's booked 2-3 weeks out. So it's are you ready right now? Okay, yeah, we're gonna go. And then you can see who's serious. It's been a tremendous cost saving to the state. As of March 15, 2019, there's been a TPP has saved $12.9 million. That equates to 100,049 jail beds saved, that's going to figures based on $129 a day. I mean, that's pretty amazing. Jail does not, from my experience with opioid, that doesn't fix anybody. Treatment does, and to be able to provide that in a quick and meaningful way is amazing. And to be able to follow up with clients who are successfully disposed of, it means they acknowledge the case, they might get probation, unconditional discharge. We're still doing well. It's been amazing. So if anybody has any questions, I have a lot of numbers, facts, and articles. Please feel free to come see me. Thank you.
All right, thank you, Blake. I think we are going to catch up a little bit. I appreciate your brevity. Perfect. So last but not least, we've invited Chief Stephen Hunt from the Naugatuck Police Department to share with you a little bit. Probably about 2 years ago, we had a chief of police from another community come here to Connecticut. He came a few times to talk about a thing called a PARI, a Police Assisted Addiction Recovery Initiative. And I invited our law enforcement partners from multiple communities, and we had a lot. We had a lot of state and local police partners come to learn about it, to learn what it is, what it isn't, how it works, how it could work, and to just get people thinking about, like our chief here in Waterbury said, today it's not just about enforcement. It is about those other kinds of connections and relationship building with community partners and connecting people to the supports that they need. And so Naugatuck Police Department wasn't able to be with us, but their chief at the time said, come back and talk to us and let us know what it was about, and we did. And Steve, I think that you might have been in that meeting the first time that we met, and then again they said, let's talk about that again, and let's see, what might need to be in place. And again, things are always changing. So last year at this time, there were a number of key pieces that were missing, that wouldn't have allowed this type of initiative to potentially be successful here in our part of the state. But we've come back to the table again and are still thinking about it and trying to figure out, how do we make a police-assisted addiction recovery initiative work? And so I'm so grateful, number one, that my dear friend Steve Hunt is now the chief of police in Naugatuck, but number two, that he's been able to join us so he can talk with you a little bit about some ideas and just, wheel turning that's happening in Naugatuck to try to find another way to stay the course as we address the opioid crisis. So without further ado, Chief Stephen Hunt, Naugatuck Police Department.
Thanks, Jen. Can you hear me back there for the microphone? Good. Thank you for having me, Jen. I can't say enough to everyone in this room about what a great job Jen does with helping our community. It's amazing the things that she does. I can't believe you pick up the phone, she's always ready to help. So it's great to have a community partner like that. And Chief Spagnola said it's all about collaboration. I can't say anything more or to agree with that statement, that in the law enforcement it's truly all about collaboration. Whether we're working with our prevention partners or fellow law enforcement agencies, we have a great relationship with Waterbury. Being right next door to Waterbury, most of our dealers unfortunately come from the bigger city, so we're constantly working with them on enforcement efforts, and we really do have a great partnership. Really excited. I got promoted about 2 months ago, and one of the first programs that I really would like to get off the ground is the Perry initiative. And basically it's a community policing movement to create non-arrest pathways to get treatment and recovery for individuals that really truly have an illness. When I first started in law enforcement 24 years ago, if you asked me then, I would never be sitting on a panel telling you that I'm not going to arrest somebody that has drugs. I would tell you that I'm going to lock them up and they're going to jail. 24 years later, I'm sitting there telling you that that is not the correct answer, that we need to get these people treatment and we need to stop the cycle of addiction. So I'm very proud to say that Naugatuck is most likely going to be the first police department in the Western region to have a Perry program. I do think, in law enforcement, we're not all about reinventing the wheel. We like to find a program that is very successful and we copy it. So right now, Manchester Police Department was the first one in the state to have what they call the HOPE program, which is heroin and opioid prevention and education. I just found out Tuesday morning that Southington is launching a program themselves similar to that. And these are just two departments that I'm reaching out to, trying to develop policies and forms for my officers to use and really get it off the ground running. I'm really happy that my good friend and actually relative, Dr. Jacoby, is here because I need to partner with a local hospital to make this program a reality. And the fact that they have recovery coaches available is really a key to the success of this program. So I will be reaching out to you, Dr. Jacoby, in the very near future. The goals of the program are simple. We want to reduce overdose deaths first and foremost. We want to get access to treatment. We obviously want to improve public safety for our community. We want to reduce crime, which is a goal of any police department. And we want to divert people away from the criminal justice system. It's time to stop incarcerating people that need help and get them the help that they need. As I said, we're still in the planning stages. I do need to get the approval of State's Attorney Maureen Platt, but I can tell you, having worked with her for a many number of years, even prior to becoming chief, I know that she'll be on board. So once I have all the policies and the forms in place and an agreement with Dr. Jacoby, I will present it to Mrs. Platt and we'll be off the ground and running. It's really exciting for me as a leader of the police department to take on such an initiative. We've also, for next school year, I've reinstituted the DARE program into our schools because, as we said, it's not all about enforcement for law enforcement. It's also about education. And we need to educate our children about the dangers of what's out there in the streets. What I did find is many years ago, the DARE program was somewhat frowned upon because people thought the curriculum really wasn't working that great. But with the opioid crisis, they've revamped their curriculum and it focuses a little bit more on what we're seeing today. So I'm going to be bringing that back in partnership with the Board of Education. So we're working on the education component. We do have a drop box in our lobby. I wasn't as smooth as Chief Spagnola to come up with some weights that he had, but I can tell you that it is used quite frequently every week. We just took part in the DEA Take Back program on our town green that was very well attended by people who would just pull up into their car, roll down the window, and hand my officers bags of prescriptions that they were trying to get rid of. So we're trying to engage the community as much as we can and get them involved. A little bit different than what you see in Waterbury. Our firefighters are not first responders to medical calls. The police department is. So every medical call that comes into my dispatch center, an officer is the first arriving person on the scene. So we do issue them Narcan. Some statistics for our community, we have approximately 32,000 residents. So we're about a third of the size of Waterbury. But in 2018, we used Narcan 47 times. 47, that's a lot for a community our size. Unfortunately, we also had 12 overdose deaths in the community of Naugatuck. And as Mayor O'Leary said, even one is way too many. So this year so far, we've used Narcan 15 times. So last year at this time, we used seven instances of Narcan, but we went on to using 47 times. This year, we're at 15 right now. So I don't see that trending downwards. I think we're going to trend a little bit up on that. As far as overdose deaths, right now we're currently at 2 this year, but we have 2 toxicology reports pending with the medical examiner that we do expect they are going to come back as overdose related for fentanyl or heroin. So we're probably most likely at 4. Again, 12 last year, already at 4 for this year. So with that, we are partnering with Jen and the Housatonic Valley Coalition. We're hosting Narcan training at our police department. We've advertised it on our social media pages. We're getting some positive feedback for that. And I invite anyone that would like to come. It's going to be held June 4th at the Naugatuck Police Department at 6 p.m. So please spread the word, and I hope it's well attended. Thank you.
Okay, so we have 4 minutes, not enough time, but we're going to make the best of it. So for those of you that have burning desire questions, because I know there are questions or comments, I'm going to ask that you make your way over to the microphone here and line up, because again, in order for it to be picked up on our recording, we need you to be at the microphone for your question or your comment, and we'll direct it to our panelists. So just panelists, please make sure that if you are answering a question, you have a microphone and it is very, very, very close to your voice so that you can be heard. We have our first person at the microphone. So yeah, come on up.
Thank you all very much for your presentations. It's been very edifying and informative to hear everybody's angle on this prolific issue. From our perspective, I think I'm the director of the Center for Renewal, which is an outreach drop-in center here in Waterbury for people in crisis. And it seems as though a lot of attention and maybe additional funding has to be made available for supports and post-recovery, post-treatment, and early recovery. The pattern has to be addressed after the treatment when so much recidivism happens. I think the big demand for beds and programming are from people who have 4, 5, 6, even double-digit treatment episodes each year. And not enough is being done in terms of creative, out-of-the-box thinking of how to really address the behaviors and the create reinforcements for lifestyle patterns and a lot of the behavioral issues behind addiction after treatment when people return to the community. So I guess that's a statement more than a question, but I'm not sure if anything's being done on the policy end of things in terms of the recidivism and aftercare.
Yep. So if you can pass the microphone down to Commissioner Delphin Rittman, please.
Yes, so we fund HVCASA, so the Connecticut Community for Addiction Recovery. They have about 4 different recovery houses or recovery centers around the state. Those essentially are drop-in centers where people can volunteer. They can help to work with on the warm line. They can work on sort of resumes. There's resume support and job-seeking support. There are groups that happen regularly, and just other sort of sober activities that people can participate in. So that's one resource that is available statewide, or in the regions of the state where there is a recovery house. Again, there's one in Willimantic. We're looking to stand up one in New Haven. There's one in Bridgeport and Hartford. So that's one opportunity.
And we find that relearning a lot of the behaviors by one-on-one contact and mentoring opportunities really assists in addressing the patterns that we see in recidivism.
Yeah, absolutely.
Well, microphone. No, it's not going to get picked up on the audio.
So, as has been shared before, I think one of the other important things that's happening is the training of recovery coaches. That is going to be the person, that's your mentor, to connect with a recovery coach. They're going to be the ones who get you to a meeting, or just that you can call and say, hey, listen, I've got a craving, I really want to go out and use. Can you talk me through this? Let's go and sit for coffee. So connect with some recovery coaches. And
Yeah.
you have a suggestion for how we can
So, and there's one piece that I'll add, because I think you bring up a really important point. Our work group, and Jennifer Dillon, our prevention core member, there's a rubric that's available through the Alcohol and Drug Policy Council to look at and reflect on your community and whether or not your community is what's called a recovery-friendly community. And it's about those supports that you're talking about, because you're right, treatment is this very small window of time, and the rest of that time is recovery time. So what does the community look like through the lens of recovery, and how does it support recovery, and what services are in place? So that rubric is actually being conducted right now here for the City of Waterbury. And the items on the rubric, checking off doesn't mean it's done. It means we're aware of it, we're addressing it, we're working on it. So that is a piece. And we are, I do know from CCAR that they're working on improving the recovery coach presence here in the greater Waterbury area. So those are some pieces that hopefully address your statement. And I agree with you. Recovery is a very long time, and we need to support it financially and appropriately. So thank you. Okay. Next question. And thank you to those of you who are staying here. And don't worry, because you don't want to get on the highway right at 5 o'clock. You want to wait until at least 5 after. So take your time. Take your time. So thank you.
Good afternoon. My name is Ralph Baker. I'm a member of the Litchfield County Opiate Task Force, and I'd like to, I'm an opiate case manager, and I'd like to applaud your efforts for Commissioner Demas. I work pretty closely with Ms. Dumont, Natalie Dumont, and she's always accessible and on point and ready to help us in any way that she can. She's awesome, and I appreciate all the initiatives and things that you do as well. And Dr. Valente, you talked about childhood trauma, and as you know, I'm a victim of childhood trauma, and I'm also a person in long-term recovery. Through the services of psychiatric services as a young man early in recovery, it helped a lot. It helped a lot, and I was able to maintain my recovery through therapy and through a lot of other mechanisms that were put in place back in the late 80s, early 90s. So that definitely a big source. Dr. Jacoby, you talk about the emergency room. I'm currently working with Charlotte Hungerford Hospital to get the MAT into the ED. I'd really like to talk to you more about the procedures you have in place, because we're yes.
If I could let you know that actually part of Demas and Western, we have been working with Charlotte Hungerford Hospital about doing that, and my understanding is that as they have partnered with Hartford Hospital,
Yes.
that now they are able to do that and have been able to have the Narcan delivered to the emergency room so that people do not leave the ED without having Narcan in hand if they have been reversed, and that they are starting MAT on the inpatient service, and that they are connecting people at their outpatient clinic either with us or with McCall's or
Yes.
with their outpatient clinic.
Yes, I've been involved with the Narcan in the ED, and I've also walked 3 clients through to get them involved with the Suboxone. I'm very intimate with that program, and I'd like to talk to people that are farther along with it, so that I can start developing to help the docs, because I know the docs are trauma focused and they just want to subdue alleviate the trauma and have them move on with it. Someone suffering with the opioid use disorder needs kind of a warm handoff. They need to be kind of coddled a little and walked along, you know what I mean? So, the program's developing, and I'm very excited about where it could go, but I see like Hartford Hospital, St. Mary's Hospital, where they're already farther along, and I don't want to reinvent the wheel, so. but it's
You know who else has a
dynamite, very good program.
You know, St. Francis Hospital in Hartford actually has a very innovative program that actually, if someone has been reversed and they start them on Suboxone in the ED, that they in real time can set them up with a follow-up appointment
Yes.
at one of their local clinics.
Yes.
So,
Yeah,
so I've talked to them at Charlotte about
On the microphone.
That's what I understood.
We could start them and then roll them in within 24 hours into a treatment facility.
Absolutely.
Right, and I've had extensive conversation with Dr. Craig Allen as well, who's really involved in all of that. So it's just exciting to see where this whole thing is going.
Commissioner.
Yeah, and so one additional thing that's happening at St. Francis is they'll also administer now harm reduction kits. So in addition to naloxone, they'll administer a full harm reduction kit to individuals on discharge.
Yes.
And so that's a new initiative as well.
And that same vehicle is moving into Torrington as we speak.
Yes. Yes. Thank you. Thank you. Thank you very much. Last but not least. Hello.
I'm Mary Ann, and I'm asking a question for the Alcoholics Anonymous public information guy on coaches. We only do alcohol, so do you have alcohol coaches for not opioid, just alcohol?
So for the,
You do?
Yeah.
Yeah.
Yeah. So the
we need to cooperate with AA and
Yep.
yeah. So who should I talk to about that?
Yes.
Yeah.
So I can give you their information. The woman's name is Jennifer Chadukowicz, and she coordinates the Recovery Coach program. And a recovery coach, a certified recovery coach, is a person who meets with someone regardless of the substance that they use, whether it's alcohol or marijuana or it doesn't matter what substance the person uses. And the recovery coach's job is to connect with the person and then figure out what they're ready for. And what they're ready for might be a 12-step recovery support like Alcoholics Anonymous, or it might be an inpatient detox, or it might be medication-assisted treatment. The recovery coach is trained to meet the individual where they're at and to find a pathway to recovery, and they recognize that there are multiple paths to recovery, and so that's what their job is. And so they're trained to address all of the substances and to connect the person to all of the different recovery paths, including 12-step fellowship.
Okay.
And so I will gladly share her contact information with you. She coordinates the program, so she trains the recovery coaches. Jennifer herself is not a recovery, like a hospital that gets the recovery coach program. What they would do is they would call once the person is medically cleared, and a recovery coach is dispatched to that hospital to meet with the individual.
Get the information.
All right, I'm happy to share more with you about it. Thank you, thank you. So there's a connection. All right, so with that, if you were an email registration, we will send you some next steps based on the dialogue that's been had here today. There is going to be a wonderful video production of this entire forum that we'll share the link to so that you can watch it, view it, or share it if you had to step out the room or came in a few minutes late with other folks. Please make sure you signed in and leave your email address clearly if you did not. Please take information on your way out, because the more you take, the less we carry to our car. And we want to thank you so much for joining us today as we stay the course addressing addiction and the opioid crisis. Thank you.